Welcome to the What's Happening Birmingham video podcast.
Hello, everyone. This is Jefferson Scott with What's Happening Birmingham. Today, I have the honor and pleasure of being with Dr. Mark Wilson. He is the health officer for Jefferson County Department of Health. Dr. Wilson, thank you for coming on the podcast today.
It's my pleasure. Good to be here.
Great. So I want to bring Dr. Wilson on today to continue to talk about the coronavirus pandemic, especially here in Jefferson County, and just discuss all the latest news. We got a lot of things to kind of go into. I want to talk about the face mask ordinance that was just put in effect starting Monday, and kind of talk with Dr. Wilson a little bit more about the 4th of July weekend that's coming up and all that's about to happen. So Dr. Wilson, before we start, can you tell people what's your title and what's your role? Because a lot of times people, when this news is breaking, going down, a lot of people's like, who is this guy and how he can shut down bars, nightclubs, restaurants, salons, and gyms?
Right. Yeah, it's certainly understandable. I'm not an elected official. I'm appointed by the Jefferson County Board of Health. And the Board of Health is comprised of 6 people, 5 physicians who are elected by the Jefferson County Medical Society, and the president of the county commission, which is currently Jimmy Stevens. So that's our governing board here at the health department, and that's who I report to. I also report to the state health officer, Dr. Scott Harris, who's over the state health department, and he is appointed by the state board of health. So I come under their authority as well, and they are made up of physicians also who are elected at the state level by their peers, members of the medical association. So it's sort of a different governance situation, as you can see, has a lot of medical involvement, and it's different in every state, but the rationale, and it's been here in Jefferson County, it's been in place and in Alabama, it's been in place since the 1800s. But I think the good part about it is when it comes to public health, you have people who have a health background who are governing this, all except for that county commissioner. And then the person who they appoint has a medical background as well. So the office of health officer, it's required that I be a licensed physician in the state of Alabama. So that's kind of the idea behind it, so that when we're talking about health issues, you actually have health people making some of these decisions. In addition to that, there's a whole body of law in the Alabama Code or Alabama law that's dedicated to public health. A lot of public health laws. I don't have them all in my head. If it's printed, it's a small book, but people can go and see that online. But there is, so I'm given quite a bit of authority through that when it comes to enforcing public health laws. We also have a lot of local regulations that are passed by our board, regulating things like restaurants and, places where people serve food. We also happen to regulate here in Jefferson County air pollution. We do a lot of different things where I'm given that authority to enforce these laws and regulations. So when it comes to the coronavirus, this is a very unusual situation, as everybody knows. I mean, it's really sort of a bizarre kind of, it's just an incredible situation we find us in this pandemic. But there is a section in the Alabama Code, and I'm going to actually pull it up for myself here to get it right, and that's why I'm looking away from the camera. But it says in Alabama Code Title 22, it shall be the duty of the county health officer to make a personal and thorough investigation of any diseases suspected to be known that are what we call notifiable diseases. Okay, those are diseases that are required to be reported to the public health department because they're diseases that are contagious or can affect the general public's health. So COVID-19 was declared by the State Board of Health a notifiable disease. So if anybody diagnoses that, whether it's a physician or a clinic or a laboratory, they're required to report that to the state health department. In fact, they're required to report it within 4 hours. So that's my job. It's my duty to investigate those. Of course, when it says me personally, I delegate a lot of that to our staff. I can't possibly do that all by myself. Then it goes on to say that if I decide that those cases of that disease are in imminent danger of spreading, that I shall, in accordance with the law, institute immediate measures to prevent the spread of such disease. Okay? So that is my duty that's described in the law. So that's part of the authority that's given to me to take these actions, which admittedly have been very drastic. Okay? I took my first action on March 16th, where I did shut down restaurants and bars and limited gatherings, several things, and then I issued some other orders. Very soon after I did that, the state adopted some of my orders and then started extending those and adaptations to that statewide. So some of my orders didn't actually stay in effect very long, but it was very drastic. And I've never had to do anything like that before. And I hope I never have to again, because, and it broke my heart. I mean, I cried after doing that. I sort of fell apart because after I gave a couple of those news conferences, because I knew the gravity of this and that I had just overnight put tens of thousands of people out of work. I get a little emotional now thinking about it. It's just both the gravity of the decision that I made and the gravity of this whole situation. And, you know, I think it is a true statement that even if I hadn't taken any action myself, really bad things were going to happen. And a lot of people would have been put out of work anyway. It was just a matter of time, and it was a matter of maybe, you know, how many people died in the process. Okay. So I was trying to do something to try to save lives. And it was very harsh, very drastic. And I promise people, it's not something I take pleasure in at all. Some people have accused me of being power hungry and an egomaniac. That's not what this is about, y'all. But anyway, that's one of the things. And just also, I think the other part that the question people are asking is, you know, in spite of what I just said, you know, what authority do I have? There's one other aspect of this, sort of two different lines of legal authority. So the other is that we're under a state of emergency, a public health emergency, which was declared by the governor at the request of the state health officer. And so it's under those conditions that some of these orders have been issued. So when the state health officer issued his orders after mine, and after he, well, anyway, a lot of the statewide orders and the current statewide order we're under, it says in the last couple of paragraphs that statewide order basically rendered my order no longer in effect. Okay, so it took over for my previous orders. But it also said that the Jefferson County health officer may institute more strict orders if indicated. And so that's the authority under which I have done like I extended the last statewide order when it came to entertainment venues, for example, for a couple of weeks. And that's the authority under which I issued this last face covering order. It was authority delegated to me by the state health officer in a state of a public health emergency. So that's, or you could see me, sometimes I'm referred to as an assistant state health officer in some documents. So it's under that authority that I'm given. It's basically given by the state. So it's not like I'm going rogue here. But it's a very legitimate question. And so I'm very happy to answer it, help people understand. And it is a little bit weird. It's like I came out from nowhere. Nobody even knew a lot of people didn't even know I existed. And, I think there are a lot of people that are very grateful for what I've done. And there's some people that are really mad at me for what I've done. And I get that because I know it's been very, very painful. And for a lot of people, the face mask thing, I think it's trivial. I'm struggling to understand why people are making such a big deal out of it. But at the same time, it is an inconvenience, and people are just really tired of all these orders and being told what to do, and they want to get back to their normal life. So I get that.
So let's talk about the face mask order. Like,
sure.
What does it cover? Who does it cover? Who's exempt? Because I saw the order when you released it, it had a couple of different rules and regulations to it.
So what it covers is your nose and your mouth.
All right.
That was a joke. Not
okay.
a joke.
Okay.
But you're asking about the jurisdiction or the area. Yeah. So it covers all of Jefferson County. I'm the Jefferson County Health Officer. So it did say in that order that at the time it was given that any pre-existing order in Jefferson County, it would still stay in place. So that of course referred to Birmingham, the city of Birmingham, which already had an order or an ordinance in place. So I didn't want to disrupt that ordinance. However, if and when that ordinance expires, then mine would take over for the city of Birmingham as well. So it didn't trump the city of Birmingham. It would just fill in if that becomes a void. So, but otherwise it's countywide. And in terms of the specifics of the order itself, it's the main thrust of it is that it covers all businesses and venues that are open to the general public.
Okay.
So if you enter one of those businesses or venues that are open to the general public, you must wear a face covering. And, it doesn't mean you just wear it to get to the door and then you take it off, obviously. It's that you must wear it while you're in that building. And it's for indoor spaces of those venues, okay? So that's one of the main features. And the other is for transportation services, buses, paratransit, taxis, and rideshare programs like Uber or Lyft. The driver and the passenger needs to have a face covering on. And, because that in my view is even more potentially of a concern than a building, because you're in a very close space with somebody else confined with, in the summertime, the window's probably up and you're also circulating air from the front seat to the back seat, et cetera. So that I think is very important. And then it does not apply for outdoor spaces, except where you might have a situation where there are 10 or more people gathered together who are not from the same household, who cannot social distance or cannot keep that 6-foot distance. So that's the main thrust of it. And then there's a long list of exceptions that I put in there. I was trying to be very careful not to overreach too much.
Okay.
With this, because I knew it was controversial. I didn't have total buy-in from our community. So I was trying to be careful, not to infringe on people or inconvenience people too much, more than necessary. So let me just mention a handful of those exceptions. One is a very important one for children under the age of 2. They should not wear a mask. It might be a hazard to them, like a choking hazard.
Okay.
It's optional but recommended. It's recommended for children 3 to 8, but we leave that up to parental or guardian discretion. Okay. But then age 9 or older, everybody's required to wear one. Now there's obvious exceptions for people that just can't wear one. Maybe they have bad lung disease and it actually makes it a little hard for them to breathe. Or, there's some people that have mental health issues or something that just makes it real hard for them to do that. So there are exemptions there for people that have certain medical issues or disabilities. We left schools out of this. That is pre-college schools, like our high schools, elementary schools.
Okay.
And the reason I did that was just to allow the schools and the school districts to make their own decisions, because that's kind of a complicated area. Like, what are we going to do with our children in school? And I think there's a balancing act there too, trying to help our children get back to normal as much as possible. So I wasn't going to mandate that all the children in school have to be wearing face coverings all the time. That may be a good idea for some ages or some circumstances, and we'll advise the schools on that, but I didn't want to mandate it. I also did not mandate it for places of worship, although, and I was just trying to be careful again, because it was so controversial and unfortunately had become so divisive. I let that sort of quote unquote religious freedom, and I didn't want to, let me back up. I don't mean quote unquote religious freedom. We have religious freedom, but the church versus state kind of questions. I do believe I have the authority to order churches to do certain things in a public health emergency, and I did before. You know, we basically closed churches to 10 or less people, there for a while, which meant most of them did not meet in person. So I had the authority to do that, but again, because this was controversial, I kind of left that alone. But let me just say, in no uncertain terms, people that are going to church need to definitely social distance. They are required to social distance under the current statewide order. And I would strongly recommend, and in my order it says this, I strongly recommend that people in churches or other worship settings wear a face covering while you're singing, while you're all reciting something together or praying out loud together, because that's a dangerous time when this germ can be spread. And then maybe wear a face covering when you're coming in and out of the building, where you're more likely to, just get close to other people. But maybe while you're sitting in the pews quietly with your family, and assuming everybody's separated appropriately, families are separated by 6 feet, then I think it's fine to take off a face covering so you're not having to wear it that whole time. But I do want to emphasize churches, because church settings and other worship settings do worry me. And we have there are many cases across the country where a lot of people, we did have outbreaks that occurred in churches and where people died as a result. So I know I'm rambling here a little bit, but I just wanted to put a punctuation mark on that one. There are a few other exceptions we made, and just if people want to read that order, we put it on our website at the health department. It's on the face page. It says click here. You can click and go directly to that and see for yourself what it says. And I would like people to sort of be aware of it. But it's all right there. And that website is jcdh.org, Jefferson County Department of Health. Just Google it and you can get to it real quick.
All right. So another thing I've been noticing on social media is a string of restaurants and bars and clubs that's been closing due to, I guess there's an honor system where the business has been reporting that their employees have either tested positive for COVID-19. So the question I would like to ask you is, what are the protocols and the procedures for businesses like that when it comes to reporting COVID-19 cases with their employees, and what are the procedures for reopening, or is there a process in place already?
Right. So let me say, first of all, that, we've been in touch with a lot of restaurant people, and one thing I'd like to say about a lot of our restaurant owners here in our area is that they really want to do the right thing. And I really believe that. And we have a really good working relationship with them here in Jefferson County. We regulate them, obviously, anyway, without COVID-19. And, a lot of restaurants have not opened because they don't think they can safely do it. Okay. And they want to make sure they're protecting their employees and their customers. So I just want to say that from the outset. We've got a lot of really good folks who care about our community who are running our local restaurants, and they're trying to do the right thing. And some have had to shut, like there are a few that have opened up and then closed back down because one of their employees has gotten it. I also knew about at least one that even without an employee getting it, they decided they had opened up their indoor dining and they decided to shut back down because they felt that their employees were at risk from the customers who were not wearing face coverings. Okay. And that was before I passed this order, but that was something that I felt very strongly about is that, you know, in restaurants currently, the employees, the serve staff or the people at the front counter are required by the statewide order to wear face coverings to protect the customers. I feel very strongly that those employees need to be protected too. Okay, they need to be protected from the rest of us. Otherwise, I just don't think that's right. You know, why are we protecting one group of people and not another? It's an issue of justice. It's not unsimilar to our smoke-free ordinances. You know, we don't allow people to smoke in restaurants. I mean, if you yourself go in and smoke at a restaurant, you're there just for a little while. Maybe it's, you know, it's not as big a deal, but for the people that work there every day, day in and day out, they can get lung cancer from that. And they do. So anyway, I digress again, but the procedure is, first of all, any case of COVID-19 in Jefferson County is reported to our health department. And then we get in touch with, we issue a quarantine order. They are automatically required by law to quarantine for 14 days if they're positive. And by the way, for the folks watching this, if you ever go out and get tested because you have symptoms, then you should quarantine yourself until you get your test results and or until we get in touch with you from our health department, just so you know. But people are, anyway, so we already get the report anyway. So the restaurants aren't required to report it to us. And then people are quarantined anyway, at least, you know, legally they are. And we actually check on people to make sure that they're following the quarantine and we get in touch with them also to do that contact tracing everybody's been hearing about.
That's what I was going to ask you about.
Yeah, we'll go over that in a minute. But so what is the obligation of the restaurant or some other business that's public facing, or whether even their own employees are together? So through the contact tracing, we may be getting in touch with some of those employees or other people as well if we get the story from the person who's tested positive that they've been in close contact with that other person. And the rule of thumb that we go by is, you know, you've been within 6 feet of them for 15 minutes or more. That's not an absolute rule. That's just kind of the criteria we use for the contact tracing. But then it's really the responsibility, it's a decision that business owner has to make. And some of it comes down to sheer workforce. So if one of their employees gets it and then say they're, you know, a third of their other employees were significant contacts and they have to be quarantined, well, then you don't have enough staff. That's potentially what can happen. And that's partly what has happened when people have closed. But otherwise they may be closing as a precaution that they've decided to make as an extra measure on top of the quarantining that's occurred. So that's, you know, and of course we you know, they need to do some other things like wipe down their areas and do some cleaning and things if they know they've had a case in there. So have I answered your question on that one? Is that, or did you have something else?
Well, I would like for you to kind of add like what procedures, like specific, like recleaning procedures, or do they require, like before, if they have to come back to work, show their employer the test results? Or I think I read somewhere, you know, there's a lot of myths and you know, when you look on the internet about, you know, you got to take a test before, you know, take a retest to make sure
Sure.
that 2 negative tests in a row that you can re-enter.
Right. Yeah, there's some different options for how you can reasonably verify that somebody's no longer infectious. So let's say you have somebody who has coronavirus or has COVID-19 infection. They've been quarantined. Per the Centers for Disease Control, there's a couple different strategies for deciding when they can come out of quarantine. And that would be if they can, excuse me.
Oh, you're fine. You're a busy man.
That's my, yeah, let me put this on silent. Sorry. I usually keep it on silent, but,
Fine.
so, yeah, so there are certain circumstances where we might try. So the rough and dirty of it is that everybody's quarantined for 14 days.
Okay.
And, in the rest of Alabama across the state, the current state health officer's order has that in there, that anybody who tests positive shall be quarantined for 14 days, just automatically. Even if they can't get in touch with you for some reason, you're quarantined legally. Legally, you have to stay at home, and your household has to stay at home for 14 days.
Oh, wow. Okay.
Yeah, it's a you know, it's a pretty big deal, but that's the rule. So that's automatic. There's certain circumstances in an ideal situation, you know, you might have tested today, but you've been having symptoms maybe for 5 days and you might have gotten infected. You know, it usually takes at least 2 days from getting infected to having symptoms. So, you know, it's possible that you get tested, but you're really not going to be infectious for more than maybe another 5 or 7 days or something. You know, that's sort of the finer points of this. So there are some cases where our folks will get in touch with somebody and get a good history on them and say, okay, it looks like you can go out of quarantine early. And there's a protocol that's based on symptoms, you know, that your symptoms have to be improving for a certain number of days and you have to have no fever for a certain number of days. That's fever without any medication to bring your fever down. Because we're getting so many numbers now, the numbers of cases in Jefferson County are now well over 100 every day.
Okay.
Unfortunately, I'm very disappointed that that's happening now. We were trying to do better than that. Anyway, that's one option to get people out of quarantine early. But now, because the numbers are so high, we're moving towards the point that the rest of the state is currently under, where it's just like one size fits all, 14 days. Sorry, y'all, because we can't possibly tease it out on 150 people a day and track all of that. The one place where we do try to sometimes get people out of quarantine early, and by early, again, I mean after we're sure that they're no longer infectious, but it's just not that blanket sort of 14-day rule, would be a healthcare worker that's on the front line that we need to get back in commission, and then other essential workers like our first responders. And forgive the term essential worker, it's just people that we need for the response to COVID-19 that are critical right now under these circumstances. So we do pay more attention to those to try to help get them back. And we sometimes use a testing protocol, you know, where you have to have a couple of negative tests as part of that protocol. And there are other situations where maybe extra testing is required. One very notable one is somebody's in the hospital with COVID-19 and it's a person who needs to go to a nursing facility or a nursing home after they leave the hospital. Because we've had major issues in our nursing homes and it's a very high risk area, they will often do like a 2-test protocol in addition to making sure they're better, just as an extra layer of precaution for those nursing facilities, because we very much do not want to make a mistake of introducing COVID-19 into a nursing home where there's so many vulnerable people.
All right. Well, I've had this question posed to me, which I kind of asked you like before we started the interview. What can the public do um, if they're out at certain businesses, restaurants, bars, and they see these certain businesses not adhering to social distancing and the face masks and the proper precautions? Is there like a phone line to call or to report that to you all and things like that?
Yeah, and I don't, I really should have it in my head and I don't, but they can go to the health department website and there's a phone number there on our face. It's just our general phone number and say that they have a concern or they want to report something related to COVID-19. And that will most likely go to our environmental health department, the same ones that do regulate restaurants and certain other entities. If they see some big concern. Now, let me just say this, that would be most appropriate where the business themselves is not doing what they're supposed to do, okay? So, for example, if it's a hair salon where the people that work there are not wearing face coverings, or maybe it's a restaurant where they have opened up and they're not spacing their tables appropriately. They have everybody, all the seating crowded in where it's clear that they've not followed the protocol to make sure that each dinner party or family is not separated by 6 feet from the others, okay? Because that's on them, right? That's what they can control. And under my face covering order, all these entities that are open to the public are required by us to put that sign on the door, on the entrances that says, it's a simple sign with a picture of a face covering that says face coverings are required to enter this establishment or however it's worded by order of the county health officer. So that's what we're requiring of the businesses. That's their part. Now, how the public behaves, they can't completely control that, right?
Okay.
So we don't want to put the businesses under, we don't want to put them in a bad position where they're in conflict with their own customers. They're certainly, if they choose to, they can absolutely say, we are not going to let you in here unless you have a face covering on and you keep it on. That would be totally appropriate if they want to do that. That's legally okay for them to do that. Any business can require people to do things like that. I mean, they've always said you have to wear a shoes and shirt to come in and sit down at a restaurant, right? They can do that. That's their right as a business. So that's one option for businesses. Another option is for them to just gently say, hey, just want to remind you that, we're under this order that you have to wear a face covering in here, and do it in a really nice way. Because, sometimes people just need a gentle reminder. Keep in mind, and I want everybody to keep in mind that there are, as I mentioned earlier, there are exceptions to the rule. These children I mentioned, and then other people that just simply can't wear a face covering. So we don't want to get nasty about it. And we don't want other people going out there and shaming people or yelling at people for not wearing a face covering. I don't have a perfect answer for some of these situations because I went into the drugstore the other day and somebody else wasn't wearing a face covering. I'm just a customer there. It's an awkward situation. Do I say something to another person that I don't know? I don't really want to go there. It did make me a little nervous, but so I don't, we don't have when people ask me about enforcement and everything, I don't have a perfect answer for you. But anyway, and we don't want the police arresting people, stuff like that. But there might be situations where where a police force or a police officer may need to get involved. And even with them, and I don't need to tell the police this, but my opinion is that that they can also gently remind people and just be polite about it. And that usually will be very effective. Most people respect the police and the badge and the authority they have. But, every now and then we get somebody who's going to be, just downright difficult and refuse to do something. Some people have seen on videos of, somebody going belligerent, when you simply ask them politely to do something, it sets them off. That kind of stuff happens. And sometimes, unfortunately, a security guard or police have to get involved. And we don't want that to happen, but sometimes it does. And just in terms of enforcement more generally, because this is the $1 million question, how about enforcement? So the health department doesn't have a police force, okay? And that's probably a good thing, but, we do have, as I mentioned before, regulatory authority over some of these businesses. We're asking them to do their part. So, we're going to, if they're not putting that sign on the door, we're going to go by there and check on them and just talk to them about it and say, hey, you need to do this. And I can tell you, 99% of the time they're going to say, oh, sorry, we'll do that. My bad, and they'll do it. But ultimately, though, the enforcement is up to each jurisdiction, each municipality to enforce it. And they have to use their own discretion as to how much they want to do that. Police forces for our different cities have a lot on them. They have a lot to do. They have robberies, they have homicides, public safety. So, and they do this all the time. They use their discretion all the time. There's jaywalking, there's turning without a signal, there's riding a bicycle on a sidewalk, which, by the way, is not legal in some areas. People don't get arrested for that stuff, or a lot of times they don't get stopped. That's discretion that they're exercising. So that still is true with this as well. Anyway, but when I issued this face mask covering, I asked our mayors to please support me in this, because we're all in this together. We're trying to keep people healthy. We're trying to save lives. We're trying to get these numbers to go in the back in the right direction and not keep going up. We're trying to protect our hospitals. And people say, oh, well, you still got plenty of ventilators and plenty of ICU beds. Well, we do still have ventilators and ICU beds, but do we want people to be in the ICU and on a ventilator? No. Our hospitals are still quite busy with this, and the busier they are with this, the more chances are they don't have the resources or the rooms or the staff to take care of other things that we all need for our health. So I think the ultimate disaster we're trying to prevent here is death, obviously, and permanent disability, which might be a thing, and our hospitals getting overwhelmed to the point where they can't take care of you when you show up in their emergency room with a heart attack or a stroke or something else, or with COVID-19, and they say, sorry, we're going to have to start triaging here. And I'm talking about the bad kind of triage, that the origin of the term, which comes from war, where you decide who lives and who dies. Those horrible, ethically difficult decisions that potentially could be made. I don't want us to go there. But our hospitals currently do have capacity, but it's silly to say that why are we worried about this because they have capacity? But that is a metric that I keep an eye on that could be, I think, the trigger or the thing that would trigger us to potentially issue, heaven forbid, issue orders that take us backwards again.
Yeah, that's what
we have to close something, would be our hospitals And just so people know, I'm on a call every week with the CEOs of every one of our hospitals in Jefferson County, and they've been wonderful collaborators in all this. Our hospitals, y'all, have done amazing work in this epidemic. UAB has really stepped up in a major way, not just their hospitals, but in other ways to help our community. And they've made huge sacrifices too. They have lost millions and millions of dollars because of this pandemic, trying to keep their patients safe and keep the public safe. That they had to shut down a lot of their operations to make sure they had capacity when this thing first hit. And they took a huge financial hit for us, for the rest of us. So I just wanted to say that because some people don't know that. But that would be the thing is if and the hospital CEOs, by the way, before I issued this face mask order, I asked them, what do you think about a face mask order? And they unanimously said, absolutely, we're all for it, because they don't have their finger on the panic button, but they're very concerned about the prospect I just described to you of getting really overwhelmed. And they're currently concerned about that capacity issue to do all the different healthcare things that they need to and want to do for everybody in our community.
Well, let me jump ahead because I know we're like a few days away to the 4th of July weekend, which presents a whole different set of circumstances.
Sure.
What are your concerns going into the 4th of July? Because you know people are going to be outside shooting fireworks.
Mm-hmm.
And there's going to be multiple gatherings, outside the home.
Right.
What are your main concerns as far as that?
Yeah, so we do have the Memorial Day experience where I think people saw video of folks, especially down at the beach, who were not social distancing. So, the same rules apply through this whole thing. And, I'm getting tired of repeating myself, but I'm going to. Okay. If you're with your own household, your own family, they're together anyway, y'all can do whatever you want to together. Go out, have fun, watch the fireworks, really enjoy time outdoors and enjoy the holiday. We all need to enjoy the holiday. Mm-hmm. We all need some R&R. But if somebody's not from your household, people that you're not ordinarily in contact with, you need to maintain that 6-foot distance from them. And so it's the same rule so that we don't have a bunch of people mingling that are spreading disease around. I would advise anybody who goes out to have a face covering, face mask with them. They don't need to wear it when they're out the whole time, but have it handy in case you find yourself in a situation like when you're watching the fireworks where you're finding that your space is getting encroached upon, or you're having to walk through an area or something where there are other people, then put that face covering on and to protect, so we can all protect each other. Certainly don't share utensils, if you're cooking, having a cookout or something like that, or maybe you've taken a picnic basket to sit out somewhere and watch the fireworks. If you're sharing anything with anybody else that's not part of your regular household, think about those contact surfaces. Another thing to carry with you is hand sanitizer, so that if you touch anything that other people are touching a lot, then, after you touch whatever that is, just pull out your hand sanitizer and rub it on real well, let it dry, so that we don't have disease spread that way. So it's the same precautions as everywhere. So we want everybody to be super, super careful. As is obvious from your question, you're concerned about it. A lot of people getting out. So it is we're worried, that's our job to worry. That's what I do all the time I worry on behalf of our community. What do we need to worry about out there about health concerns? So, I'm concerned about it. And if people let down their guards and start partying and start just acting like everything's normal, we could see some bad outbreaks from this, from the 4th of July weekend. And the way the numbers are looking right now, I can confidently say that right now we have more coronavirus circulating in our general community than we've ever had before. Like, it's worse now than ever, y'all. So keep that in mind. And it's everywhere. Okay. It's everywhere. Now, I will say, if I may, that a lot of what's driving the numbers right now is a younger population than was initially. It's the, upper teens to maybe 50 age group that's getting a lot of it right now. The good news is a lot of those folks are younger, healthier, so they're less likely to end up in the hospital and die. It's certainly possible. And we certainly have some people in that age group that have asthma, have diabetes, have high blood pressure, who could still get sick, could still die. But, a lot of young, healthy people out there, they're not going to necessarily get in trouble with this. They could really regret they had it, because it could be really miserable to get this. But some people have mild illness. It's like, well, what's the big deal? Well, the big deal is, who do they go home to? Yeah. Who else do they come in contact with? It might be your mother, your grandmother, older person or sick person in your household. That just think about it. If you're young, 20-something, invincible, how would you feel if you found out that you got this virus and took it home and one of your dear family members died as a result? How would you live with yourself? So I just want people to think about that very carefully and take this really, really seriously. Still have fun. I hope to see the fireworks. But please, please be careful. Don't let your guard down. Don't make this all worse for all of us. And as we were talking about restaurants and stuff earlier, if we get careless, not Mark Wilson, health officer, all of us are going to end up shutting down the restaurants or the stores that we like to go to. Even if I don't issue an order, you're going to shut them down because they won't be able to operate because too many people are sick. And here lately, I've been reading, Apple stores just closed.
Yeah, I saw that too.
Okay. I didn't do that. That just happened. They did that because they decided they couldn't safely operate anymore because of the numbers, the amount of disease we're seeing in our community. So we all have a role to play in this. And I can tell you, if all of us just were careful and did all the things I just described, hand sanitation, social distancing, face coverings, if we all did that reliably, if everybody did it as well as I do it, okay? I'm not boasting, but I'm very, very careful. I'm here at the health department right now. In the health department, we have a few people in our building working. My assistant is just outside the door. If I'm getting up and leaving my office, I put my face covering on. We're all doing that here at the health department. I might not see anybody when I go down to the break room and get a snack, but I've got my face covering because I don't know who's right around the corner in the hallway or on the elevator or the stairwell. So if everybody were that careful, and also, by the way, when I use the doorknob or whatever to get in and out of the building, I use hand sanitizer or wash my hands. If everybody would consistently do that, if all of us all did that together, we would have this thing whooped in a couple of weeks. And we'd be done with it. Of course, we'd have to do it across the entire state, across the country. But this is in our control. And you as an individual, to protect yourself and those around you, your neighbors, your loved ones, you are in control. You can control this. So that's my word of encouragement. We're not all helpless victims here. Everybody has a role to play. And right now, because businesses are opened up, and because we're trying to get back to normal, my light just went off. Because of that, and you've heard the governor say it, we're depending on people to exercise personal responsibility. Now that's a big gamble. Human behavior being what it is, human nature being what it is, that's a big gamble. But that's what we're doing right now. We're banking on everybody to do their part. And that's because we don't want to do these draconian things like just shut everything down. We know we can't live that way forever. So we're at the point where we're counting on everybody to do their part. So I'm going to put in a quick plug here. The health department is trying to be as green as possible. So we have lights that automatically turn off in all of our rooms if there's nobody moving around. So my light just went off. That's what happened.
Oh, okay. Now, one thing I was going to ask too, and this, just since I got you in front of me, I would remiss not to ask you this. What's the effectiveness of latex gloves? Do you think if they don't have hand sanitizer, but if people go out to public places like they go in the grocery stores or clothing stores and they wear like latex or plastic gloves, is that safe?
Yes and no. So, and it doesn't have to be latex gloves. It could even be something like gardening gloves. So if you're going somewhere where you know you're going to be touching stuff a lot, and I know some people do that when they go to the store, it is an extra layer of precaution that's not unreasonable. But how you put them on and take them off is important. So healthcare workers that use these gloves for procedures, certainly like surgery doctors or nurses that work in an intensive care unit where they have a patient who has something that's very contagious, like a bad bacterial resistant staph infection, that they're trying really hard not to spread around. They have a special way of putting their gloves on and taking them off so the gloves themselves don't get germs on them. Okay. So if you have gloves on and you touch something, you're still touching your face, then that glove's not doing you any good. Or if you are taking them on, putting them back on, and then holding them with your hands that are contaminated, then that's not helping you either. So before you put the gloves on, you should use some hand sanitizer or wash your hands, then put them on. And then when you take them off, you need to immediately dispose of them if they're disposable, like latex gloves, and then clean your hands before you touch anything else, because the gloves themselves can become contaminated. If you use the gardening gloves, which is very reasonable to go to the drugstore or something else, when you get back in your car, take them off, toss them on the floor of the car or something. And then you don't have to wash them necessarily, but they need to be quarantined for a while, and probably by the next day they're fine, because the virus doesn't live forever on surfaces like that. But that's just something to be aware of. I don't wear gloves if I go somewhere, I went to the grocery store the other day and I used the grocery cart and I touched a few things. I just was careful not to touch my face while I was through that process. And then I used hand sanitizer as soon as I got back to my car. And, I also put hand sanitizer on my steering wheel and stuff like that, just to, as a precaution. So that's very reasonable. Gloves are not necessary, but if you don't use them properly, they're not going to help you, and you could accidentally maybe make things worse.
All right. Well, any final thoughts you would like to add? Want to tell the public that you haven't had an opportunity to tell, through press conferences.
Yeah.
And news.
Well, I don't know who all's in the audience here, but we have a lot of different folks in our community. We're very diverse. There's some folks in our community who are very, very concerned about coronavirus. We have some people in our community who are really scared because they have diabetes, they have lung disease, they might be older. Those are the folks that have gotten in touch with me. A lot of people have gotten in touch with me personally to tell them what they think about all this and making suggestions and such, or expressing concerns. And for those folks, and I'll add African Americans as well, because we know that African Americans unfortunately are at higher risk Some of that's just because African Americans in our community and in Alabama have more of these chronic diseases that put them at risk. But I would, a lot of the African American friends that I know are very concerned, and they're like, thank you for doing what you've done. I wouldn't mind if you did more. Okay. And not to make this a racial issue, but I'm just saying that people that are at risk are of one camp that are trying to do their best to be safe, but they're begging the rest of the community to help protect them. And they're begging me to do what I can to protect them because they don't feel safe. They feel vulnerable. So that's one part of our community. There's another part of our community that maybe folks that haven't ever seen anybody get sick with this. They've not been affected. It's kind of like, what's the big deal? Like, you keep saying the sky's falling, but I haven't seen the sky fall yet. We've been in this for several months. So I just don't think this is a big deal. Why are you making such a big deal out of this? And when I issue a face covering order, it's like, whoa, like you're infringing on my rights. This is America. How dare you tell me that I have to put something on my face?
And it's Independence Weekend coming up, 4th of July weekend coming up.
What's that now?
I said 4th of July weekend coming up, Independence Weekend. You asked me for a face mask on this 4th of July, Declaration of Independence, all that.
Yeah. Well, I'm asking you wear a face covering and make it red, white, and blue, okay? Whatever. Put your favorite political candidate on there, whatever you want to do. But I guess the point I'm making is, well, there's a couple points I want to make. This is really real. I talk about numbers. I talk about statistics. I'm sure there are a lot of people are really getting tired of hearing me talk about anything or about just these numbers, this many cases, that and this and that. Numbers don't mean a lot to a lot of people, but we're talking about real lives here. We're talking about people that are getting sick, dying. We're talking about a lot of people who are losing their loved ones. So I'm just begging everybody here in Alabama, here in the Bible Belt, where we have a reputation for caring for one another. Now is the time for us to really care for one another. Put others before self. I'm a Bible believing Christian myself. To me, it's such a little thing for us to do something on behalf of another person. This is what Jesus taught us to do. Lay down your lives for others, or not put so dramatically, just do some little thing like put on a face covering for others. It's a minor inconvenience, but love your neighbor as yourself. So I just frankly am having a hard time understanding how some folks on social media, who some of them advertise on social media that they're a Jesus follower, are also saying things that are fairly belligerent and sometimes maybe not so kind about how dare you tread on my rights and make me wear a face covering. And I get rights, but there are multiple things that we are required to do by law where we lay down our rights or we give up something for the benefit of the public's health or safety. Seat belts, motorcycle helmets, certain rules we have to follow in a restaurant. The list is very long. We don't have a right to just do anything we want to. And don't worry, I'm not going to be the dictator that takes over the world and tells you have to wear a face mask all the time for the rest of your life. This is a very unusual situation. It's a public health emergency. This is all temporary, but very important right now for us to all get through this.
All right, well, Dr. Wilson, thank you for taking time out your day. Originally planned this for 15 minutes, but I'm so happy that you fully explained it,
Yeah.
Because I feel like this is a very important topic, and I think people really need to know this information.
Well, sorry if I talk too much. I can do that, I'm a talker.
You're fine. And there's an open invitation whenever you want to come back on the podcast and relate to the public.
Sure.
So feel free.
Yeah.
Come
Well,
back.
in normal times, our health department does an incredible number of different things for our community, and I'm very proud of that. And it's a huge honor and privilege for me to be in a position to be part of it. So when we're through this COVID thing, I'd be real happy to talk about a lot of other things that would impact people and just help people know what we're trying to do to improve the health and well-being of our folks in Jefferson County.
All right. Well, thank you again, Dr. Wilson. Thank you all for watching this video. Please check out what'shappenedbirmingham.com for more videos, and don't forget to subscribe to my YouTube channel. Thank you all again, and have a great 4th of July, and everyone, let's social distance and wash your hands, and use a face mask. So thank you all again, and have a great day. Bye-bye.
Bye-bye.
Thank you for watching the What's Happening Birmingham video podcast. Please check out our website, app, or subscribe to our YouTube channel for the latest videos today.